Hi, welcome to the section of cardiology. This is Dr. Jaitly. In this video presentation, I'm going to be talking to you about how does intracardiac defibrillator ICD work. It's a commonly asked question. A lot of people want to know what's a pacemaker, what's a defibrillator, what's a CRT device. These are some of the things people are starting to familiarize with. And of course, people going to medical students taking exams or residents, fellows who is advancing into further knowledge and expertise, please go ahead and supplement this basic information with medical journals and articles, etc. I always urge. My interest here within this quick video clip here is to show you exactly how the defibrillator is implanted and how it works and what does it have to offer. So it's pretty much like a pacemaker. You see like a generator which sits under the subclavian fossa. Essentially that's inserted into a subcutaneous pocket by a small insertion. The whole procedure is done under local anesthesia with mild sedation, obviously in the operating room or in a cath lab. And one gets to do this by attaching then the wires. Now, normally there's one wire, but you could have a dual wire where you could be having an atrial wire which ends somewhere here, which I've not shown in this. And then there's a ventricular wire, which is obviously going to the tip of the right ventricular apex. Now, the difference between a pacing wire and a defibrillator wire is that there are coils within the wire, as you see. I've shown them in the blue. One is the proximal coil, which normally it's around in the right atrium area, and the other one is at the tip of the right ventricle. That's where the other wire is, or the coil is rather. And the coils really are meant to be used in order to defibrillate from within the intracardiac at a very, very, very extremely low potential compared to the one that we do normally, as you've heard of, where we defibrillate externally when somebody has a cardiac arrest. So what is a defibrillator? An intracardiac defibrillator is a generator with wires pretty much like the pacemaker wires attached along with the coils, where a defibrillation is programmed into, a pacing programmed into, and the wires in general are anchored exactly like the pacemaker wires, and it works like a pacemaker. In addition, it also works like a defibrillator. So it's an automated programmable intracardiac device which is capable of pacing for a slow rhythm. So it resets the rhythm back to normal rhythm, or terminate lethal tachyarrhythmia like a VT or a VF, and that could be also programmed to the threshold one desires. Now, the lead, as I said, has a way to be programmed externally and even remotely on a telephone. So if the patient is not able to come to the office or to the hospital for interrogation on a, say, 4-monthly or 6-monthly basis, because once the pacemaker is in, somebody has to go back and have them reprogrammed, and they also assess how often did the pacemaker kick in, or how often did the defibrillation was deployed during the course of those 3-4 month period that's required to be for the patient to be interrogated for. And one sees that as a marker, and then also the battery life is assessed, the current of impedance is assessed, then the resistance is assessed, and all of those things can be adjusted and programmed for the next intervals to follow. So broadly, the indications for ICD, once again, are obviously a post-MI, like an acute MI, and then after 6 weeks, if the left ventricular ejection fraction fails to increase above 30%, a defibrillator is required in that setting, an ICD, to improve the patient's survival, because an ejection fraction of 30% or less is very, very prone for ventricular sudden deaths, including VT and VF. So that should be taken into account, and certainly ICD placed in will help improvise the mortality and morbidity in that individual. Out-of-hospital cardiac arrest or sudden cardiac death episodes, specifically so in young athletes or unexplained cardiomyopathies that occur, they are they meet the indication for ICD as long as there is no coronary obstruction. Because there is a coronary obstruction or obstructive coronary artery disease, as we call it, then obviously bypasses or corrections of those angioplasties may be recommended. But in the absence of any of those, then ICDs will be a strong consideration, specifically with a sudden cardiac death episode as an out-of-hospital cardiac arrest. Heart failure with reduced ejection fraction of less than 35% for all causes, regardless whether it's post-MI or otherwise. Specifically so with a bundle branch of a QRS duration more than 0.14 second will require an ICD, and in that case a CRT is helpful. Now here in an echo, this is an echo mode where the atria are at the bottom and the ventricles are at the top. The coils are placed in, and this is the CRT. So this is the CRT device that's placed into the right ventricular apex, if you will. And this is cardiac resynchronization therapy, we call it. And that basically corrects the dyskinesia that's present, and so helps improve the circulation and therefore helps improve the segmental motion of the septum in order to have the left ventricular ejection fraction more effective. So that's in a nutshell. Defibrillator, the CRT, and the indications, and what the leads look like, what the coils look like, and of course a basic idea as to what an ICD is and what the placement entails. And it's a day in and day out procedure. Pretty much you come in the morning, get the procedure done, and by half a day you're back home. There are some precautions that they'll advise you not to lift anything heavy, can't go to the gym, and obviously can't bathe for a few days unless there is a airtight, watertight application applied to the generator area where the generator is sitting in that subcutaneous pocket, because last thing you want is any infection going into that area. So just routine precautions, and other than that, it's a life-saving device, and extremely innovative, and has changed the course of the illness rather dramatically over the past 10-15 years, ever since it's been employed for heart failure and post-MI purposes. Thank you so much for your attention. Hope you enjoyed this discussion, and looking forward to meeting you again in my next